team at AstraZeneca is really excited to be here at this year's ADA meeting. We've been working hard to really push the boundaries of science for the benefit of patients, and this year we have 86 abstracts here at ADA across our entire product portfolio, including 11 oral presentations and 3 late-breaking abstracts. We have studies across all of our products, and we have innovative products in all of the new categories for the oral and injectable products for type 2 diabetes, including the GLP-1 receptor agonists, the SGLT2 inhibitors, and the DPP-4 inhibitors. So we have new clinical data for each of those products, exenatide, saxagliptin, and dapagliflozin. We also have some real-world evidence and health economic studies for our products as well. One of the things that's really exciting in the area of diabetes right now are the fact that there are these new products in these new categories, each which has unique and in some cases complementary mechanisms of action. So we've been studying and learning how to use these drugs in combination with one another. One of the studies, for example, is for dapagliflozin, known as Farxiga here in the United States. And in this clinical study, we showed that when dapagliflozin is added on to a background of saxagliptin and metformin, compared with placebo, those patients have significant additional benefit in their lowering of their hemoglobin A1C, as well as reduction in weight and fasting and postprandial glucose values. And a higher proportion of those patients were able to achieve their hemoglobin A1C of less than 7%. So that combination therapy approach really does seem to make sense and work for patients with type 2 diabetes. Just as clinical trials add important scientific information, it's also important to understand how drugs work out there in the real world once they're approved. And we've this year brought real world evidence and health economic data to the ADA meeting. As an example, one of the studies that was presented yesterday was an abstract showing that exenatide administered once weekly by Durion, as compared to liraglutide administered once daily, or Victoza, not only had a significantly higher rate of adherence in those patients, but those patients ultimately had lower total health care utilization and lower total health care cost. So that's something you can't learn in a clinical trial, but you can learn in the real world. And so having both the clinical trial data and the real world evidence really helps patients and their providers have the full set of information to make clinical decisions.